Parabens, retinol palmitate, hydroquinone. Oh my! Today, I'll tell you the real deal about these allegedly dangerous ingredients. And stay tuned until the end of the episode for the question of the day. If you answer it correctly, you'll have a chance to win a free skincare product. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. There are ingredients in many products, not just skincare products, which under specific circumstances are dangerous. That I get. But what I don't understand is that then, by extrapolation, they are unjustifiably alleged to be dangerous in all circumstances, regardless of context. This does an incredible injustice to the ingredients, the products they're in, and more importantly, to you. Examples of such allegedly dangerous ingredients in skincare products are retinol palmitate, hydroquinone, and parabens. But the list goes on and on. So let's look at a few of these. Retinol palmitate, a popular ingredient in sunscreens, was fed to rodents at enormously high doses, out of proportion to any possible human consumption or absorption. The rats developed tumors, and therefore some people say retinol palmitate is unsafe in humans, despite there being no evidence that you can extrapolate the occurrence of tumors in rats to humans, even if humans could absorb the same impossibly high doses of retinol palmitate given to the rats. Moreover, it also turns out that the strain of rats used had an unusually high incidence of the same tumors even without retinol palmitate. Next are parabens. They're chemicals used as preservatives in skincare and other products to prevent bacterial growth and contamination. They were found in human breast cancer tissue in a very small study of 20 subjects. Because parabens are known to have some very weak estrogenic effects, their presence in the tumors was noteworthy, but certainly doesn't prove that parabens cause the tumors. The amount of parabens in the samples on average was 55 nanograms. And by the way, 1 nanogram is 1/1,000,000th of a gram and less than 1/10,000,000,000th of an ounce. What was left out here is that the control specimens with no tumor tissue, on average, had 34 nanograms, 2/3 of the level in the tumors. On to hydroquinone, which has been the gold standard in skin lightening topical bleaches for decades. It's known to cause a disease in humans called ochronosis, in which the skin turns a bluish-gray color, but only when used at enormous doses on large areas of the skin for years, at 10 or 20% concentrations, which aren't even available in the United States. But using it at 2% in small areas like age spots on your face for a month doesn't cause ochronosis, which is a disease I've never seen in over 30 years of practice, while treating more than 10,000 patient visits per year and prescribing hydroquinone frequently when appropriate. With all of these chemicals and many others, the movement to not allow them in products is equivalent to throwing out the baby with the bathwater, despite the bathwater being pretty clean. Ultimately, of course, though, it comes down to you and your comfort level. But don't avoid ingredients because you've heard they might be harmful. Only avoid ingredients that you know are harmful based on real facts, because otherwise you might miss out on some really effective skincare products. Now, for today's skincare trivia. Answer today's question correctly, and you'll be entered in a drawing to win a free skincare product. Submit your answer at dermtv.com/trivia within 3 days of this episode's airing. Today's question is, in the study on parabens, what were the names of the rats in the experiment? Just kidding. The real question is, in several episodes, I've mentioned that peptide-based products are a new alternative to which of the 3 ingredients I discussed today. And don't forget, you can find the answers to all questions in past DermTV episodes. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.